Everybody, this is Dr. Dwayne Olson. Today I am working on some chronic knee pain. So our friend here, she's a 30-year-old female. She's had this for about 5 years now, right? Yep, and no in particular injury or anything like that. You own your own construction business, so you're just in a vehicle a lot. She's very healthy. She takes care of herself. She knows the things, dietary things and triggers that cause her to have issues. So we've already discussed that. And so she's done MRIs, X-rays, everything's come back normal, which is great. Everyone never wants to hear that for some reason. Everyone wants to hear, oh yeah, that's the problem. There's something broken in there. And I never love to hear that. I love to hear it when everything is good, all the ligaments and all the bones and everything are good. There's no tumors, there's no things deep down that are bad. So then that makes the job easy for me because I know musculoskeletal stuff and fascia can play a big role in chronic pain. So what we're looking at today on her quad here is her fascia and her muscles that come down her quads. Those are 4 muscles that come down and help her do things like stand up, go down into a squat, get in and out of the vehicle 87 times. What leg do you bring up first to get up into the vehicle? The right one.
Yes.
Which one holds you up? Your left one.
Yeah.
So how many times you get in and out of the truck?
All day
Long, right? So she's getting in that huge F-350 out there. Yeah, that's a big jump for somebody who's, you know, what are you, 5 foot tall. So maybe we need to get you a ladder. Maybe then, you know. So what we found here today, we've been working on her quad and her IT band, a little bit on the inner muscles right through here, is we found a lot of grittiness. And in our world, when we find grittiness, we start to compare it to the other side and see that she's got grittiness and pain on this side. And that's just the fascia and the muscles. Muscles get broken down, but they have good blood supplies, so they heal faster. Fascia doesn't have a really great blood supply. It protects blood vessels, but once it gets broken down and once it gets torn up, you get some scar tissue. So that's what we're coming in here, and we're breaking up some old scar adhesions, and she can feel that. We've already done a little bit of work on it, so she's kind of smiling, trying to keep a smile on her face. And her main issue for me was on this outside here. You can feel it's just kind of like hamburger meat, and you can just feel it. Like every time we go over a couple bumps and every time we work all the way up and through here, you can just see the smile gets bigger on her face. So what we'll want to do with her is do probably 5 to 6 treatments to try and get this healed up. And we're also going to give her some anti-inflammatory type things like turmeric at home that help decrease inflammation as well as restore the joint itself. So a few things that she can do, she's been dealing with it for 5 years, but will decrease inflammation, will get the muscles and the fascia moving properly again so it doesn't create more inflammation, and then she'll be back to work out. Sound good?
Yes.
Awesome.
Thank you.